Hello and welcome to our low back detective series. So during this series, we're going to be focusing on everything low back related and going into different conditions, how you know if you're suffering from that condition, and what we do here at New Spring Chiropractic to find a way to help you heal, get better, and then stay better. So our first part of this series, we're going to be talking about sciatica. So let's investigate and let's think about how to know if you have sciatica or the signs and symptoms of that. So sciatica is a common term that indicates that you have pressure and pinching on one or more of the nerve roots that make up the sciatic bundle. So what it looks like on the model here, okay, is these nerves coming down and out the lumbar spine, and those nerves branch off and they make a common nerve, this very thick nerve called your sciatic nerve. So when that happens, when we have direct pressure on there, what you're going to feel most commonly is a sharp shooting pain that extends from the low back. It's going to start from the low back and it's going to go down at least into the buttock, but it can also travel all the way down the leg to the knee and even all the way as far as the toes. So if you have that type of sensation, that's a good indication that you are suffering from sciatica. Now, it doesn't have to just be sharp. It can also cause numbness if there's pressure on these very sensitive nerves coming out of the low back that make that sciatic bundle, because these nerves are going to come together and make a larger nerve down here called the sciatic nerve. You can also feel a pressure in that area, or you can have a burning sensation in that area as well. And why it might feel different is depending on what exactly caused it. So in order for us to figure out how this happened, we're going to start with a detailed set of questions. We're going to take a history on you, because the last thing we want is to start physically moving the back without talking to you about things like your health history, what's happened recently in your life, if there's any factors that caused this injury to occur. We've had people from other offices say, yeah, I had low back pain, I went to another office, but they basically just put me right down on the table and started adjusting me. That's the last thing we want to do, because we can miss an important part of why you're having sciatica. We need to think of ways that you might have injured it, including like a sports injury or a slip and fall. Maybe you were in a car accident recently, or further back that's contributing to why you're having a flare-up or this brand new issue. We're also going to ask if you have things that can affect the integrity of the nerves. That include things like diabetes or any neurologic conditions, because we know that things like diabetes and other issues that affect the nerves, they can actually cause them to degrade and actually cause them to be injured. So we want to make sure if there's any of that that's playing into it, that we know, in order to tell you exactly why this may be happening, because it's a big mystery a lot of times why we start to have those shooting type pains. We're going to ask you about your day in and day out kind of activities. Do you have a physically demanding job? Do you sit at a desk all day? Do you have young kids that you're picking up? Are you putting stress on your back in a certain way that could have set this off? So we're going to go into all of that, and we're going to have a good idea on where exactly we need to look first. We're also going to ask you questions about the rest of the spine, because an area in the neck that's not moving correctly can make the low back hurt even worse, because it's all connected intricately. So tune in for part 2, and we're going to go into the exam process.